Hello, I'm Steve Main with Fitness for 5 and Fitness for 10, here with Dr. Nario doing our regular series of interviews. And Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can look them up online and see some of the treatments they do and what they're all about. So I definitely recommend them. Biointegrative Health Center in Reno, Nevada. Welcome, Dr. Nario.
Hi, Steve. Thank you for the invite again. Always a pleasure.
Okay, so we want to talk about the brain. So I understand that this month, June, is Brain Awareness Month. What's that?
Well, Steve, as the word itself, it's now us telling people about what's important about our brains. The thing here is we have to. This movement was started because of the trending in mild cognitive impairment that's getting, of course, more prominent as we move forward, as the evolution of our time is seeing. We always hear about dementia. We always hear about Alzheimer's. We always hear about Parkinson's. So this is the reason why Brain Awareness Month is here, to emphasize on these things and to be preventive. So my main point here is to define what our viewers need to understand about basic concepts, such as mild cognitive impairment. And this term is most commonly used and will be actually not seen in many. The thing here is it's about assessing the memory and how subtle the changes are. And it's characterized by ongoing memory problems. It's like your everyday problems, like forgetting my keys, using the word whatchamacallit all the time, leaving the stove on. Well, I hope that doesn't happen. And this also is kind of progressing into the worst picture of memory loss, which is called Alzheimer's. And Alzheimer's, most of the time, related to genetic factors, lifestyle, environmental factors. I have to emphasize on that because we can control these things. And all of these can affect the brain. And for the mild cognitive impairment, the ones that we always again see is like forgetfulness, mild confusion. But for Alzheimer's, these are in the severe forms of presentation. So over time, recent memories will also be started to be erased slowly. And as we advance from this disease, symptoms vary from person to person. And the worst case scenarios I've seen, severe confusion, attention problems, language difficulties. So current treatment and approaches focuses on actual mental functioning, managing all these behaviors, and slowing or the delay of the disease progression.
Well, you and I talk off camera all the time. We just were doing it about diet and food and what we put in our body. And, it seems like every year it's harder and more expensive to eat healthy. So can you talk about some of the causes of, brain issues that you just mentioned?
Yeah, that's true, Steve. You brought up a good point there. The thing here is there's so many different causes of brain injury, dysfunction, or impairment. One for our athletes who are listening, contact sports and rigorous exercise. Yeah, you would see jiu-jitsu, boxing, and not only that, but also isolated exercises or sports such as CrossFit. That also involves you from jumping to running, crawling under, and who knows who's going to have a head trauma with those activities. Yeah, the Ninja Warriors, you would see them jumping around also. And the other ones, again, in general, not just for athletes, cardiovascular, high blood pressure, high cholesterol, hidden infections such as syphilis, Lyme's disease, medication use and side effects such as opiates, and even alcohol. That's not a medication, but that's a substance that can also alter the brain. And the most common thing out there, and I hope everybody knows about it, is the Western diet. And this is, of course, the fast food around us. But here's the thing, it's the most common cause and the most modifiable. The standard American diet actually is composed of salt, refined carbohydrates, calorie dense, poor nutrition, saturated fats, and sugar. All of these contributes to the degeneration of the brain, inflammation, even diabetes, insulin resistance, so much free radicals that are formed, and mitochondrial dysfunction, and gut destruction, and even whole systemic toxicity.
Yeah, again, like you and I talk about nutrition and diets a lot, and there's so many out there, and a lot of them are mainly just ways of eating. But you brought up the Western diet, also known as the standard American diet. Not really a good thing. So how can the Western diet slash standard American diet, what does it do? Can you give us a few more details on how it can damage the brain?
Well, the thing here, Steve, the damage is actually starting from the gut. With the gut, as we all know, is getting introduced to excess nutrients. This will lead to weight gain and thus leading to obesity. So this results into expansion and add-ons of fat tissue. So fat tissue by itself is inflammatory. It produces enzymes, and this will call in cells, our immune system, to add more to, of course, our immune system is very protective. It doesn't like anything that's harmful, which is the fat cell. So they will fight those fat cells, and in the process of fighting them, it will create all these enzymes, the inflammatory enzymes, and this will start a chain reaction of inflammatory responses that surrounds the fat cell. So if you have this one fat cell in your body, and imagine if you get obese from all the Western dietary choices that you're making, now you're counting not only one fat cell, you're actually talking about millions of fat cells. So that the tire gut that everybody's seeing, the immobility, all of these are promoting the multiplication of this inflammatory cells called the fat cell. And as we have higher fat cells and inflammation, we also would expect insulin to not be working. That's why diabetes is always creeping in the backside of obesity. And the thing, as I mentioned to you, waist circumference. For everybody out there, if you really want to assess, like, how obese am I? How, you don't need a blood test. You don't need any, you just need to see with your eyes, and even your pant size. If you're not fitting your pants, that's not a good thing. So after eating that Big Mac, you would also notice that you're feeling sleepy, and it's hard to, because it's very hard to digest, and it feels heavy when you eat that yummy burger, because it's inflammation creeping and starting.
Okay, so you just made me think. So if I go buy some pants that are like a 46 waist and they fall off of me, that means I'm not obese, right?
Well, that'd be cheating. If you buy something larger for you and you know it's going to be falling off just to make you feel good, that's not right.
Okay, so there's all these ways of eating out there: keto, carnivore, vegan, Mediterranean. So is there a brain diet? You know, is there something, a way of eating that people may adopt that are beneficial to a healthy brain?
Steve, there is. So this is what we call the
Doesn't
brain.
surprise me.
I know, right? Where did he come up with that? Well, there actually is. Brain healthy diet is what it's called. It's not made of Skittles. It's not made of M&Ms. It's a diet that is based on evidence, medical evidence that provides brain protection, and that would lower the risk of cognitive decline and dementia. Of course, everybody hears dementia, they think of Alzheimer's. The Mediterranean, so it's a combination of so many things. We're not going to give you one, oh, this is the whole brain diet protocol. No, it's going to be piecemeal of everything. For example, one of the biggest stars of the show is the Mediterranean diet. This leads to lower concentrations of these inflammatory enzymes that I was talking to you about in the brain. And when you're on at least 1 year of the Mediterranean diet, you can actually see it on blood testing that the inflammation that affects the brain goes down. Another one that people are usually on is called the keto diet. Keto diet, but I have to put it on parentheses, plant-based version of the keto diet. And the thing that I want to emphasize here, if somebody has a family history of Alzheimer's, they would always hear about the gene called ApoE4. So ApoE4 is something that you should ask your doctor to test. If you have a lineage or a family tree of Alzheimer's and grandma, uncle, or grandpa, and the thing here is you have that inability to use glucose in your brain. It's slow, it gets slower as you age. That's why when you get on a keto diet, you're actually putting fatty acids as your fuel for your brain, thus lessening the severity of the possibility of Alzheimer's. So ketones are very powerful when you use the ketogenic diet for the brain as a brain source of energy, and also lowers the chances of cognitive decline. And one thing that you like is intermittent fasting. Intermittent fasting is very beneficial for the brain. And the thing here is anybody who our suggestion for brain preservation is more than 12 hours of fasting. And if you have that ApoE gene, which can be detected through testing, you probably should be doing 14 to 16 hours of intermittent fasting to maintain that brain health.
Yeah, I do like the intermittent fasting, and I do it. My fasts are usually 18 hour fast with a 6-hour eating window. And you find that once you start doing it, it's easier than you think. You're just not hungry. So
Right.
it's something that I do, true. So you kind of hit on some things that can benefit or prevent brain deterioration. Is there any specific recommendations that you have? You mentioned the Mediterranean diet. That's becoming popular, the Mediterranean diet combined with keto, and you kind of combined it with plant-based. Some people do better with plant-based proteins. Their body, everyone's different. So do you have any specific ideas or thoughts or recommendations specific in general? I mean, that doesn't really make sense, but for a brain, if somebody wants to say, I want to be on a brain healthy diet.
Right. So that's a good point, Steve. The thing here is when we talk about specific recommendations, I want to just bring it out there that it's not only for people who are starting to forget, people who has the history of Alzheimer's. We always want to be preventative here. So that's why I always tell people or my patients that even the regular athlete, for example, after a rigorous exercise, that brain got shook, got moved when you did a CrossFit session. For somebody who just is just doing a brisk walk, the brain needs stimulation. You went through a hard day just analyzing so many things. That's already an indication that you need to be on a brain healthy diet. Plus, of course, the symptoms that you would notice in yourself. So we're going back to the specific recommendations that you were asking about. Let's go to the Mediterranean diet. The thing here is I want to emphasize healthy fats because why? As we can see, the brain is one big glob of possible fat. And the fatty structure and the nerves are composed of fat, so that when you build fat, transmission is better. The synapses, they're just moving like clockwork. And sources, so this is a good way to remember this. I just heard of this right now, but it's very significant. For seafood or fish, think about the SMASH, acronym. When I say SMASH, S for salmon, M for mackerel, A for anchovies, S for sardines, and H for herring. So these are the best choices for seafood in terms of brain health, but not only brain health, but good choices of omegas. And of course, we always know avocados, extra virgin olive oil, nuts, and the emphasis always now is the ratio of your omega-6 and omega-3. It should be 4:1. And another recommendation that we always see in the kitchen is turmeric. It lowers brain inflammation. Always use as a spice, especially in curries. If you like to go to Indian restaurants, use it with pepper for better absorption. But if you don't use it for pepper, it's also good. Why? You're not going to be absorbing it, but it stays in your inflamed gut. It actually helps the inflammation of the large intestines and small intestines. And another one would be mushrooms. I'm not talking about the one that's psychedelic here, but it's the edible and medicinal. It upregulates nerve factors and also the immune system. You heard of lion's mane, and that's the best one really for the brain because it produces what we call the brain-derived neurotrophic factor, and also helps with the adaptogens for stress. And brassica, the broccoli, cauliflower, cabbage, Brussels sprouts, the allium family, the onions, garlic, shallots, leeks. Though it brings you bad breath, but it improves detoxification, increases glutathione production, and neuroprotection. And of course, eat according to the rainbow colors. Darker, colorful vegetables and fruits has an indication of higher phytonutrients. It supports healthy detoxification, and of course, I always want to emphasize hydration in this warm weather that we're having right now, and high fiber to eliminate all the toxins in our gut.
Those are some really good tips. I guess they call them hacks now, right?
The hacks, the life hacks.
So I guess you could probably incorporate, healthy eating for your brain if you're eating paleo or Mediterranean or even carnivore. You could probably implement some of these healthy brain nutrients into your diet, right?
Right, and the key here is, right, the diet is not really a diet, it's a lifestyle. And
Right.
not one diet fits all. It's usually a combination. The key here is you just have to find the right one for you. Because when your friend says, hey, keto works for me, it doesn't mean that it'll work for you. You just have to find your own sweet spot.
Sure, and then anyone could incorporate some of these brain healthy foods with when they find that sweet spot, right?
Right, and you mentioned about, yeah, modified keto, modified plant-based. There's just so much creativity out there right now about diets. It just means that, hey, I found a way to tweak my keto that works for me best. And that could be applicable to almost anybody.
Okay, so this is a fun one for me. So let's talk about your clinic, Biointegrative Health Center. You guys do a lot of treatments, a lot of very unique, amazing treatments, in my opinion. So is there anything you can do in the clinic, in your clinic, any treatments or anything, there's gotta be, I'm sure there is, that can help brain health? What do you do?
Yes, Steve, that is something that we do offer here. So the one specifically for brain health is number one, as I mentioned to you about the importance of fat because of the composition of your nerves and synapses. We give the infusion called phosphatidylcholine, though it's known as a liver cleanse, but it's a fatty based substance, meaning medicine, that actually, when infused, helps build that fatty layer, not only for the brain, but also for nerves all over your system, and thus improving transmission. And when we talk about the brain, we're talking about circulation. Where is that brain getting its blood supply? So that's where chelation therapy comes into play. When we have high heavy metals, and also we have calcium or plaques in our coronaries, the heart vessels, and the carotids, the neck vessels, you are going to have a hard time giving blood supply to your brain. You need to clean these blood vessels up, and chelation will do that for you, such as EDTA. And other IV therapies, such as oxidative therapies, we call it with that term, and these are your hydrogen peroxides, your ozones. It just brings more oxygen to areas of your body that are not getting ample amount of supply. And we all know every organ thrives on oxygen.
Wow, that must be why I am so smart, because I've had 3 of those treatments in the last 2 or 3 weeks. I had the liver cleanse.
Everybody can go through your radar now.
Yeah, so I feel smarter.
That's
Okay,
good.
so a lot of great treatments done at Biointegrative. Again, you guys can check them out online. Thanks for being with us. That's Dr. Nario, Biointegrative Health Center.
All right, well, thank you again, Steve. As we all know, knowledge is power. And thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.